Hi guys, it's Dr. Eric Lindquist with SonoPath. I've been scanning for about 30 something years right out of school. And I came up with a term a number of years ago called resolution depth. And I wanted to share that with you, what that concept is, because it's very important when you are trying to optimize your images and trying to select a machine that is going to be adequate to great for you, and decide how much you have to spend for that. Right. And so we never know what's going to come through that door to scan in veterinary medicine. It may be a beagle, it may be a ferret, it may be a 140-pound mastiff. We don't know, but we have to have the physics and acoustics on our side, and we have to have the machine that's going to be able to address that. And one technique that I came up with years ago to decide which machine is going to be solid for me is resolution depth. And that is the depth of resolution that your image is presenting to where you can diagnose something. Can you see an adrenal adequately to say there's absolutely no problem with that when the adrenal is 7, 8 centimeters of depth, right? And a mastiff, for example, or a Rottweiler. And you can do things to close down the distance between the probe and the structure with sedation and manual compression and shortening the real estate, as I say, between the probe and the structure. But if your machine can't penetrate to 8, 10, 12 centimeters, your resolution is only going to be solid in the near field in the first, 5 centimeters of depth, right? And so you need a machine that is about 8 to 12, 8 to 14 centimeters of resolution depth, because then you're going to be able to scan anything that walks through the door. And you may have to change frequency of your probe or change from a workhorse microconvex probe to a low frequency probe. And that's all you have to do. But realize that even the more powerful machine that you have, the deeper the penetration, but even the better overall resolution, contrast resolution between tissues, between adrenal and surrounding fat, or between a common bile duct and the other structures in the portal hilus, or the gastric or gastrointestinal wall layering. All of these things are important to have resolution, and power is essential. And then you adapt the frequency to it. But get the more power first. You can never have enough power in clinical sonography. So try this resolution depth technique and see how that works for you, comparing machine to machine to machine, and find out which machines that you like. Ask anybody who does actual scanning with that machine, clinical sonography, and does a lot of cases, and ask them about it and how they like it and what they don't like it. Every machine has its positives, every machine has its negatives. It's just a matter of what you can live with and what you want to optimize, right? And then test different animals out on those machines. And I'm going to show you how to do this and use resolution depth as your key factor, because that is direct reflection of how the machine is made, but more importantly, how much power penetration it has, which is essential. All right, hope you enjoy. We're going to explain a concept called resolution depth. Now, resolution depth is a term I came up with a number of years ago to describe the depth on the screen that you can diagnose something. And it's very important from a telemedicine standpoint. Obviously, we receive images here at SonoPath from tons and tons of different machines and different probes and different combinations. And we always try to help optimize the image quality, right? And in all of the submissions that come in. So we support privately on that. And a concept that is key to that is called resolution depth. So obviously you can change your depth in your machine from 3 centimeters of depth to 5 centimeters of depth to 15 centimeters of depth, 10 centimeters of depth. In a beagle dog, you're going to be anywhere from 5 to 10 centimeters of depth, right? And so that doesn't mean that everything in the 10 centimeters of depth is of resolution that's adequate quality for diagnostics, because you get contrast resolution issues and acoustic penetration issues owing to sound beam attenuation. So the sound beam goes through, it gets absorbed or interfered by artifact or various tissues, and it just kind of peters out, right, towards the end of the screen. And a lot of this has to do with acoustic power and frequency. And so you can change the frequency on your probe, but if you don't have the acoustic power to push the image, push the signal through the tissues to the depth of the screen, you're not going to have resolution in the far field, beyond 5 centimeters, 7 centimeters, 8 centimeters, 10 centimeters. So therefore, we have machines that are quote unquote 5 centimeter resolution depth machines, and typically they run in the $20,000 to $30,000 category, right? If you're buying new, right? And then you have the 7 to 10, 7 to 12 centimeter resolution depth machines. And typically those are in the $35,000 to $50,000 range. It doesn't mean every $50,000 machine has resolution depth of 10, 12 centimeters. You have to do the testing yourself. And this concept will help you select a machine properly that has adequate resolution in the far field, in the deeper tissues. If you take a beagle cranial abdomen, you need 10 centimeters of depth in the cranial abdomen from the subxiphoid to the diaphragm. And, all acoustics being equal, you need to test a machine on the same animal and test the next machine and the next machine, same position, keep the physics the same, and test to see what the resolution depth is. That is the depth where you can make something out solidly to be diagnostic, to where you can sink your teeth into it and say, yes, that's what's going on, I don't know, or versus no, it's nebulous, I don't know what's going on, right? And then, of course, there are software issues and acoustic interference and things like that play a role in it, but we're going to pay attention primarily to frequency and acoustic power in this presentation. So we're starting off with a high resolution 14 megahertz probe, right? So the higher the frequency, the better the resolution. You can see this infiltrated portion of intestine. You can make out all the layers and loss of layering, which is key, in the hypercoic fat around it to tell us there's inflammation there and there's a lymph node popping in. Okay, so if you take a look at that now, what's the resolution depth? Well, it's high frequency, so your depth of resolution is not going to be very deep. High frequency probes, the linear probes, they're made to have high resolution in a superficial field. So I would say 2 centimeters, nice and solid. 3 centimeters, there's just fat down here. So I don't know if, this looks fairly diagnostic. I can make out curvilinear patterns in the fat. If I had a structure down here, I would probably be able to see it pretty well. So this is a 3 centimeter resolution depth presentation with 14 megahertz, which is extremely high frequency, used for thyroids, intestines, spleen, eyes, things like that, right? And so this is the highest resolution we're going to get with a mid-level machine. Okay, so let's move on to a more common scenario that we use our microconvex probe. Now, every machine has a microconvex probe, usually toggles between 3 megahertz and 10 megahertz. In this particular probe, some of them are 4 to 8, some of them are 3 to 9. It varies, right? But it's your workhorse probe. It's the one you use in most 80% of your abdominal scanning, right? And so this is a very overweight cat. And you can see all this falciform fat, so the sound beam comes through, hits the gallbladder, and you have the liver, and you have the diaphragm. Okay, so if I look over my resolution depth, I can see pretty solid resolution all the way down the diaphragm. I can see the duodenum. It's kind of attenuates. You can see if I want to look at the fat here, or the gallbladder, or the common bile duct, or the or the colon over here. These are all things that I'm going to see fairly decently. And so I would go down to, let's see, we're at 1, 2, 3, 4, 5, 6 centimeters resolution depth. Now, my focal point here is right about 3.5 centimeters or so. That's going to be my maximum screen. So what I would do here, or my maximum resolution for this image. So what I would do here is, if I'm testing out machines, I'd have 3 machines that I'm interested in lined up and move this cat over to the next machine, and I would make sure my focal point's in the same spot. I would use a microconvex probe and the presets that are in the machine for the appropriate animal, and I would image it, and then I would count down and see what the resolution depth is. Now, if it peters out at 4, peters out at 3, if I have a tough time obtaining this image and I have to really sweet spot it to get the same image I did on the other machine, I would probably exclude that machine right there. And the reason is because what you're doing is you're testing this out on, okay, this machine hits it solidly, this one I have to work at, which means for the next 30,000 scans you're going to do on that machine, you're going to be working at it, right? So just eliminate the other machine. Then go to the next machine and try that out. Maybe it matches this one, maybe it's better, and then you have 2 machines in play, right? And then go to the next animal and do the same thing, go to the next animal and do the same thing. And I like to use the liver and S-step 9 through 14. And the reason is because the cranial abdomen is the most challenging part of any animal, right? So you're going subxiphoid, which should be fairly clean unless there's something in the stomach. You're going to go intercostal, which we're going to see some images here. So that means the sound beam has to penetrate through the body wall, get in between the ribs, and get into the liver to make sure that you're catching all of the lesions that may be in the liver, right? So I think testing machines and resolution depth and 9 through 14 is really solid. And then you just make a note, okay, resolution depth 6 centimeters solid. Okay, great. So then we go to the next one, right? And this, maybe you have an animal with pathology. This is a cat with an ugly carcinomatous type left liver mass. Of course, you want resolution depth solid when you have pathology, of course, because you want to make this out. I can tell this is significantly pathological, significant disruption of architecture. So I want the acoustics that are going to penetrate through this. And this is a short axis S-step 11, focusing on this mass. Now the sound beam penetrates on through, gets down to the diaphragm, got some upper GI over here, and I've got a solid resolution depth, which I need for this patient at 5-6 centimeters. So I'm solid in multiple views, 5 to 6 centimeters. So I take this animal to the next machine and I test it out just like we did, because we already eliminated the first one because we know where that's going to be problematic for us. So now we have two machines in play, and maybe this one, then I would test power Doppler, for example, right? How's your power Doppler on this lesion compared to the other one? How's the color Doppler on this lesion compared to the other one? Because color Doppler and then power Doppler are very, very sensitive modalities. So your physics have to be optimized, right? And there are machines that do really good Doppler and there are machines that don't. And a lot of times it's correlated to the power of the machine, okay, along with the software and other things. But if you have a sound beam that is penetrating well with solid acoustic penetration, you're going to have a better color Doppler and power Doppler signal than you would with a weaker machine, okay? So this is a resolution depth solidly at 6 centimeters so far. So now let's make it a little more challenging. Let's go this dog is an older dog. Older dogs dry up like raisins, so their acoustic penetration tend to be more difficult than a young dog. So don't go and scan a 6-month-old beagle. Everything's going to scan well with that. You want to do a 16-year-old beagle, and it's trying to like penetrate sound beams into a raisin, okay? Because the water content in the older animals dries up, right? And so younger animals have a higher water content in their tissues, and therefore they image better, right? So you want to challenge the machine. And this is a pelvic urethra. This is S-step 3 getting into this prostatic mass. This is a mineralizing prostatic mass. And the acoustic penetration gets on through here. You have some artifact from the colon. You have an artifact from the pubic bone. So there's a small window to get in there. But I get down in here. The colleague did. I didn't scan this. It's a telemedicine case. Solid 6 centimeters resolution depth in an old dog. 14-year-old. I don't remember what this dog was, but he looks like he's about a 50, 60 pounder, right? So now I take this over to the next machine that's still in play and do the same view and see what happens, right? And then I check the box or don't check the box. Maybe I give it a grade 0 to 5, right, on resolution quality at 6 centimeters. Okay, so let's go to the portal hilus. Okay, this is S-step 11, or you can get there from S-step 11, or you can get there from S-step 13, or S-step 14 with 1 second through 1.5 seconds through the C-loop approach. And we get in here, and here's our pylorus. So the stomach is going to be robbing some echoes. So the sound beam's got to penetrate through that. And then it gets to the portal vein. And we see the portal vein branching with the vena cava. This is a shunt hunt. It's a negative shunt hunt because the portal vein and vena cava ratio are 1 to 1, right? So there aren't any extrahepatic shunts. But I'm mainly looking at my Doppler quality here, right? My sectors may be a little bit wider than it should be, so I'm wasting some echoes there. But I've got nice solid flow at 5 centimeters of depth, because that's where this Labrador, this is a young Labrador, obviously, so it should scan really cleanly because it's a bag of water, right? And so the acoustics are better. The acoustic penetration is naturally better in this dog. Now, if I had a 14-year-old Labrador, same position, the acoustics would be poorer. So maybe I pull up an old Labrador and challenge this. But my good, solid penetration of the portal hilus is solid, so I'm testing that out. My resolution depth with color flow is 5 centimeters, not a problem. So I could probably go deeper without a problem, and I want to challenge that, right? And so let's get a bigger 9-year-old golden doodle. So he's 3/4 of a raisin. He's drying up a little bit, so the acoustic penetration isn't going to be as good. So I'm going through, this is an intercostal approach, and we have this mass here, hepatomatous or probable hyperplastic mass, but not likely a problem, but it's going to suck up some echoes, and then I get down to the gallbladder, pretty solid, and then a little bit beyond that. So that's about 10 centimeters on this microconvex probe. I haven't even changed frequency yet, right? So I have 10 centimeters pretty solid here through this cranial liver, right? And this cranial abdomen with the liver. So I got 10 centimeters, box checked, move it to the next machine, try it out, see what happens. Count my depth here to 10 centimeters. I'm good. Okay, I have a 10 centimeter, at least a 10 centimeter resolution depth machine in an older dog, right? And then, so now let's move to the lower frequency. So this machine has two different low frequency probes. This is a macroconvex probe, so a big footprint getting through the ribs. So the sound beam has to penetrate through the body wall, gets absorbed by these rib shadows, so it's sucking away the echoes. But when I hit that sweet spot, or when the colleague hits the sweet spot here, they get into the deep liver down by the diaphragm. So I'm putting an arrow right about where the sweet spot penetrates, and I can still make it out. I'm about 10, 11 centimeters in this dog, and then there's diaphragm. So there's really no more dog to image. So we're solid there. Okay, so I'm 10 to 11 centimeters, pretty solid. And let's change the angle back to the same dog with the hepatomatous type mass with a lower frequency probe. I'm 11 centimeters, pretty solid. So I'm good. Once I get that sweet spot down, I'm penetrating 11 centimeters. So now I take it over the dog to the other machine and try it out there. And then we change to a different low frequency probe. This is a microconvex low frequency probe. It's the only one that I've ever seen in veterinary, and I really love it because I can get through I can get between the ribs pretty solidly with a low frequency. So you can see when you drop the frequency to 3 megahertz, the image quality drops. That's just physics, right? But your depth of penetration increases, and I can still make out down to 11, 12 centimeters in this dog as it gets deeper into the tissue, right? So still confined curvilinear patterns here at 12 centimeters until the dog runs out of liver, right? So I'm solid. So this machine is about a 10 to 12 centimeter resolution depth machine. With the microconvex probe, it's about an 8 to 12 centimeter resolution depth machine. And I would say 12 centimeters with acoustics that are favorable, like a younger dog, a big, 4-month-old, 6-month-old, 10-month-old, a Labradoodle, for example, or Mastiff even, you can still use the microconvex probe. But as they get older, the physics are not in your favor, and therefore you have to lower the frequency. It's just physics, right? Now, if you have a standalone $70, $80, $90,000 machine, there's going to be even more power, and therefore you're looking at 10 to 14 centimeters resolution depth without even working at it, and if the machine is configured properly, all being the same. So what I would do is I would take the low frequency probe in the next machine that I'm testing out, get this same view and see how it does. And it may only be a macroconvex. And it's like, okay, do I want to deal with the macroconvex probe or not? They don't have a microconvex probe, right? So if they don't have a microconvex probe and you have to deal with a macroconvex, you say, well, I can do the same thing with a microconvex. Maybe the other machine is better with the microconvex low frequency probe because it makes it easier for me. So this is why resolution depth is so important. And I strongly encourage, and I get on my soapbox and say, try different machines out. Don't listen to salespeople. Listen to people who actually scan with the machine. Okay, and then test it out yourself. So if you have 2 or 3 machines are pretty much in your price point, and if you're going to do big boy, big girl sonography, you have to be in the 35 minimum with one probe and to 50K. That's where you need to be. If you're going to do both cavities, expect $45,000 plus or minus, because you're going to need at least 3 probes to do both cavities, right? So just budget it out. The ROI takes care of it. The difference between a $25,000 machine and a $40,000 machine, or a $30,000 machine and a $45,000 machine, is about a month of scanning. And the lifetime of a machine is about 5 to 7, 8 years, right? And so, but test them out head to head and check off the box with the resolution depth machine. I didn't invent physics. It is what it is. These are experience-based techniques to make sure you make your purchase correctly, that you're going to be happy with, because there's nothing worse than fighting with a machine that is inadequate to allow you to get good resolution depth and telemed out and make your specialist happy, because then they have a 10 to 14 centimeter resolution depth to work with. And therefore your reports become better and they're not nebulous and nothing says, oh, you didn't find the right adrenal gland and I don't see it. You know, it doesn't look good on you. So check your resolution depth first and then decide what you need to do from there. Okay, hopefully this helps. And if you need us for anything, we're at sonopath.com. Okay, this is doing this live now because it's a bit different than on the computer off of telemed views. But this is an upper model that's a bit more recent than the ones I showed on the computer. But if we're looking at resolution depth live, right, and if you look over to the right here, there is 10 centimeters, right? And so I'm looking at the resolution depth, and I have down to the diaphragm and the gallbladder. And so my resolution is pretty solid at 10 centimeters. All right, so, and this is with a C11 probe and an 7 megahertz frequency, right? And so and this is an overweight, tense abdomen German Shepherd. So he's about 85, 90 pounds, kind of a wine barrel. And so this can be challenging, and he has tense abdomen on top of it. So all those things interfere. And then when you get to the left adrenal gland, this is about 5 centimeters, but the left adrenal looks prettier as well if you have better acoustic power, which this one has better acoustic power than the last models that I showed you earlier. And then the right adrenal as well at 5 centimeters. So that's the way to assess your resolution depth on your machine. So make sure you're at least at 8 to 10 centimeters solid on challenging animals. And again, this is a 10-year-old German Shepherd, about 70, 80 pounds. So this is a Bichon live and just still images, but you can see we have 10 centimeters resolution depth here on an older Bichon. So an easier scan, more harmonic from a physics standpoint. The dog was not tense, but you can see solid 10 centimeters. And the pyloric outflow, portal vein, and liver, no issues whatsoever. And then the right kidney, right adrenal in this case was about 6 centimeters or so. Very solid. You can make out the isoechoic, the slightly hyperechoic nodule without a problem. The pancreas without a problem. So if we go back, our left adrenal nice and clean. So that's what you want to shoot for on your mid-sized dogs. This is a resolution you should be getting without a problem. And I'll follow in the next video with a much larger dog with a tense abdomen where the physics aren't as favorable, but you can still get solid diagnostics at 10 centimeters without an issue. So this is a spaniel cardiac, and it has a bigeminy arrhythmia going on, but look at the acoustic power here and the clean image and clean Doppler. And this is what I was talking about. Doppler is the most sensitive part of the scan, and we're 10, 12 centimeters with the heart. Of course, the physics are in our favor because we're going through fluid, and he has some mild volume overload and typical MR, but the color flow is pretty solid even with him moving around. And then my spectral Doppler is clean, and you see the kind of the abnormal rhythm going on, but you see nice envelopes on the spectral Doppler at 10, 12 centimeters. That's what you want. That's an acoustic power thing along with software, along with correct frequency, and the frequency I'm at 3.5 megahertz on this. So these are things to test regarding resolution depth and the Doppler assessment.